Let's pick up Arlene. It's just a real interesting mix of people that the Connections service helps. So folks have different reasons for barriers to transportation. Sometimes it is due to a medical condition or just due to age, they've lost their license. And sometimes it's economic. Sometimes it's distance. There's a lot of factors that play into the need for this service.
Transportation tends to be one of the biggest social determinants of whether or not you're going to get the health care that you need. So something like the Connections van allows those folks who don't have the ability to get to their appointments to get to their appointments. It's pretty simple. How can we take care of you if you can't get here?
So I hope you're staying cool. Arlene, are you? Okay, good.
My name is Arlene, Arline.
And how long have you lived in Dallas?
We moved into Dallas in 1979, whatever that is.
About 40 years ago, right?
Yeah.
Mm-hmm.
Mary Jo and I connected right away. And she and her husband and I connected right away because we have done a lot of traveling. We have a lot of things in common.
And we started going to Costa Rica. Love it. We went there 10 winters. That's the dry season. January, February, March. When it's rainy here, it's drying there. We stayed in this bed and breakfast, and 3 years later, we stayed there again. And we went down to the restaurant on the corner, and I walked in, and he said, I know you. You were here 3 years ago. And I, good grief. What kind of impression do I leave on people anyway? My husband passed away in January of this year, and but I plan to stay here. He was 93, almost 94 when he passed away. Sharp as a tack. He would have never had an accident. I'm the only one in the family that's had an accident.
Oh, yeah?
Community dollars and volunteer support, that's what makes the program happen.
To hear their stories is really inspiring. Life changes. And they're in a different situation now, right, than they were 20 or 30 years ago. And you meet people like this all the time. So what did you do this week? Tell me.
Let's see, I'm getting more forgetful. What did I do this week? Bingo. I played bingo one night. My son came over one night, and then my friends came. I have a sewing machine, and I read a lot.
You know, I used to sew too. I really like to sew. I wish I had more time to sew.
Because there are people like me that can't walk, and obviously they can't drive if their legs don't work. It's very helpful to us to get to and from doctor's appointments. They have very nice drivers too.
May I ask how old you are?
I am 91.
You're making 91 look really good.
Thank you.
Good enough, huh? You realize how much their lives are impacted by a medical condition, perhaps, or their economic situation. And so to be able to give something back to them that we both get something out of is really meaningful to both of us.